All right. Hi, everyone. So I'm going to talk a little bit about eating disorders. We start off with some statistics that actually I think I need to update because these are from a couple of 3 or 4 years ago. And so there's probably some differences in the occurrences at this point, but they were pretty significant at the time. And so just to kind of use some context and social milieu of kind of how eating disorders develop. 5 to 10 million adolescent girls and women do struggle with eating disorders and borderline conditions, and that's been pretty stable over time. 1 million boys and men struggle with eating disorders and borderline conditions. So often, like we see with general mental health issues, we don't seem to see a lot of men presenting, but there's a lot of questions around, is it that they're not really experiencing some of these issues, or are they manifesting them differently? And so that's something that comes up with eating disorders as well. The number of people with eating disorders and borderline conditions is triple the number of people living with HIV and AIDS. Eating disorders affect at least 3 times as many people as schizophrenia does. So it's a very significant disorder that we want to really pay attention to. Among college females, 78% reported binging experiences and 8.2% use of self-induced vomiting to control weight. So lots of college females talk about eating way too much or more than intended in a given situation. 5 to 20% of college females do have eating disorders, so there's a pretty wide range there, 5 to 20%. 1 to 7% of male college students suffer from eating disorders. And approximately 10% of eating disorder individuals in general that come to the attention of mental health providers are male. So again, it's significant number of male. I'm just curious as to why there's such a wide range of facts. Depends on kind of how they're being reported and how they're being tracked. So yeah, I think we do.
As an initial student that went to your counseling for or is it just how did you find out?
It's incidents in general, so there's national surveys that are done, and so folks are kind of do retrospective studies. So yeah, and that's why I feel that there's such a wide range because some of the age of the folks that are doing the treatment, some of it's more general, so there's sort of an aggregate of all of that specific. Okay. So what are the different eating disorders? There's several that we typically talk about, and most folks have heard of these at this point, but I like to go through specific definitions. Anorexia nervosa is a serious and potentially life-threatening disorder that is characterized by self-starvation and excessive weight loss, and also a real sort of concentrated, focus on body image as well. The refusal to maintain a body weight at or above a minimally normal weight for that person's age and height. It's an intense fear of gaining weight or being fat, so it's accompanied by this fear. Disturbance in the experience of one's body weight or shape, and undue influence of weight and shape on a person's sense of their self. So folks will not see themselves accurately, not see themselves as other people see themselves. A lot of times folks will still report feeling fat or looking fat even when they're 78, 80 pounds. So there's a real distortion that comes with that. And then there's a loss of menstrual periods in women and girls post-puberty. So that's another telltale sign that there's some sort of anorexia. The bulimia is also potentially life-threatening, and it's characterized by the cycle of binging, overeating, again, more than intended in a significant amount of time. In a particular amount of time, folks go out of control with the eating episodes. A lot of times they're eating to sort of, cope with stress and different kinds of things we'll talk about in a minute. And then compensatory behaviors that are designed to undo or compensate for the effects of binge eating. So someone will overeat and then do something to try to get rid of it so that they don't feel pain. Regular intake of large amounts of food accompanied by a sense of loss of control over that eating behavior. Regular use of inappropriate compensatory behaviors such as self-induced vomiting, laxative abuse, diuretic abuse, fasting, or excessive compulsive exercise. We do that a lot, both exercising 4 or 5 hours a day to make up for their eating. Frequent dieting, and again, an extreme concern with body weight and shape. And again, that your body weight and shape really is the predictor of how you feel about yourself and your life. And then we have binge eating disorder, which is the type of eating disorder that's characterized by recurrent binge eating and without the compensatory behaviors that we see in eating. So folks will eat large quantities of food in short periods of time. They typically use food to cope with stress, emotional conflicts, or daily feeling out of control over their eating behavior, feeling ashamed or disgusted by their behavior. And there are several behavior indicators of binge eating disorder that include eating when not hungry and eating with fear. Oftentimes, folks with binge eating disorder will appear to be overweight, whereas folks with anorexia appear to be underweight, and folks with bulimia tend to appear normally weight. They're 5% pounds of what it probably should be. So there's some differences depending on what you might see in the presentation. Important to point out from where I come, from my point of view, is that it's not just about dieting, eating, and body image. It's really about sort of the emotional and cognitive things that are going on with the person as well. So you'll see a wide range of cognitive and emotional problems that are concurrent with eating disorder behavior. And there's a lot of distress over body size and shape. There can be comorbid depression, anxiety, and just mood swings in general. Because if you're not regulating your food intake properly, you're not getting proper nutrition, you're not taking care of yourself in that way, it's really difficult to maintain a stable mood and to really build up. A lot of times there's this all or nothing thinking that goes on with folks with eating concerns, low self-esteem, perfectionism, and an inability to tolerate feelings of negative feelings such as self-soothe. And so one of the things that's really important to understand that often the eating disorder behavior is a mechanism that folks use to cope with uncomfortable feelings like anxiety, depression, low self-esteem. Okay? I like to put this up a little bit because it's sort of this vicious cycle, and kind of this more specifically focuses on what happens when someone is starving themselves, and kind of you start off, kind of thinking a lot about, needing to lose weight, needing to maintain a particular kind of weight. You focus on food and eating and not eating too much, or so on and so forth. And as you don't eat enough, your stomach can kind of shrink, and you feel full more quickly when you do eat. So then that discomfort of feeling full, even when you're only taking in a little bit of food. Then you get muscle loss, and your stomach starts to protrude. And so then you see your stomach protruding, and then you're like, oh my gosh, I'm so fat, I'm fat. Then your perception of fatness are reinforced, and so then you do more restricting. And then fluid retention and bloating can follow, and also reinforcing more of that, I need to go lose weight, and this is happening here. And then all their distorted body image will worsen. And as you become more fixated on refusing food in attempts to correct the body image, the disorder worsens because the more you restrict food, the more you think about food, and the more you want food. And so you're really in this really difficult, cycle that goes on and on. And again, without proper nutrition, when you're not getting enough, stuff going on in the body, you're not feeding great enough to be able to think clearly. And so the disordered thinking can really get to be huge proportion. So it's real difficult. In terms of treatment for eating disorders, it's a really multifaceted approach. We not only want to have a psychological intervention and provide some sort of therapy, individual therapy, group therapy is actually one of the most effective mechanisms to treat eating disorders. But of course, with all the shame that goes along with eating disorders and many of the other conditions that we talk about, folks are really reluctant to get involved with the group, when in fact that's the one thing that actually helps so much more than anything else that we do. But we also want to get the family involved. Oftentimes there's dynamics that are going on that folks are responding to. And again, when you think about the eating disorder behavior as the coping attempt, the coping mechanism, you have to look at what else is going on in that person's environment, what are they trying to cope with, and oftentimes friends and family members can help them kind of figure that stuff out. Medical treatment is very important, especially if someone is underweight and not maintaining enough weight to be healthy. We want to make sure that they're being monitored, checking electrolytes, checking for different kinds of malnutrition and so on and so forth, and really kind of getting the basics down and look at that. Nutrition counseling, medication, and if it's somebody who's really in a serious way, underweight, not functioning well, really needs it, hospitalization is something that can bring all these